Hi everybody, welcome back. We're continuing our series of videos on randomized controlled trials, essentially the gold standard for uncovering causal effects. The last couple videos explained why, and in this video we're going to continue on talking about the Rand health insurance experiment from the 70s and early 80s that randomly assigned people into different insurance groups. So in the last video, we talked about that, introduced the experiment, talked about standard errors and how we can tell whether or not something is statistically significant from each other when we're looking at observable characteristics between samples in the randomized groups. And so we're going to carry on with that and look at what the Rand health insurance experiment actually did. And remember, the first thing we're doing is checking for balance to make sure that the characteristics are similar across all the randomized groups. So we're going to check for balance between the randomized treatment and control groups. And this should be pointed out that this is baseline health. Essentially, what we mean here is that this is pre-treatment. So before they were given some different types of health insurance plans, these are their pre-treatment health outcomes. Okay, and so baseline health before they were given the insurance and looked at later. Here we're just looking at the groups. So remember, we had 5 plans here. The catastrophic plan, which was essentially no equivalent to or approximately no health insurance, all the way up to free. Okay, and so actually there were 4 plans. This last one is any insurance, so that would incorporate any of these 3 middle. So we have the means of the people in the catastrophic plan, and then we can compare those means to each other group to see if we can check for the balance to see if there's any statistically significant difference in the groups. And we're going to use our rule of thumb as we did last time. So when a difference is larger than approximately 2 standard errors, that difference is said to be statistically significant, and it's unlikely to be due to chance. And so let's take again family incomes. Actually, let me just scroll up here. Remember, in our first table, table 1.1 in the book, Mastering Metrics, purely observational data, no randomization, we had a difference in the mean family income between groups of $60,000, only $1,355 standard error, and 2 times that standard error is not even close to the difference. So with the difference being larger, it is not just chance that these incomes are different in normal observational data. But taking that family income variable in our randomized groups, and again, this is back in the 70s, so the data is a little dated. That's why we have kind of a smaller family income there. But the family income in the catastrophic plan group was $31,000. Standard deviation in square brackets, standard errors in parentheses. And so the differences here are 2,000, 900, 900. But we can see that the absolute value of these differences in no case here is the difference. And actually, if we want to really compare this to table 1.1, we can essentially look at those in a catastrophic plan versus those with free health insurance. And so we see the people with free health insurance, they have lower incomes in that randomized group, again, pre-treatment. But the absolute value of this difference is not greater than 2 times the standard error. And so if we just want to look at that here, family income from column 1, the catastrophic plan, it's 31,603. From the free plan in column 4, free, it's 30,627, and that comes from our difference, which is 976. Okay, and what we're doing is we're comparing, again, the absolute value of the difference relative to, is it greater than or equal than, greater than, equal to, less than 2 times the standard error. That difference, the difference is actually minus 976, but the absolute value of the difference is 976. 2 times the standard error is 2 times 1345. That's this number here. 2 times 1345 is 2690. And so the difference is less than the standard error. That means that the difference can be attributed to chance. So it is totally possible, just by chance, that somebody could end up in this group or this group. And so it really is a random sample, and we can see that's holding in almost all cases, all throughout this table. When we're checking for balance, we see that not only are the observable demographic characteristics essentially similar across all groups, so we have an accurate comparison across all groups there, we have the similar thing here for their general health. Okay, so general health index, for example, 70, and the difference here from the free group is 1.3 as a difference, but 0.87, 2 times 0.87, which is 2 times the standard error, is 1.74. So the difference, again, is not greater. The absolute value of this difference is not greater. It is actually less than 1.74, which is 2 times the standard error. So again, even for, and that's going to hold for cholesterol, blood pressure, mental health, almost all of these, and in all these other groups too. In most cases, we have a balanced sampling of groups. So we really do have random samples. Their demographic characteristics are similar to each other. Their health characteristics are similar to each other. And so now we're going to provide them with these different types of insurance over a period of time. And then we're going to check to see how do their health outcomes change over time. Are we going to see differences in the general health between catastrophic, deductible, coinsurance, free, or any insurance. And so what we're going to do is take that and look to see what happened. Okay, so a lot of kind of lecturing there. I'm going to summarize some of the things I just said. So we have the incomes of those in the catastrophic, which is almost none, catastrophic health insurance. The incomes of those in that group are no different than the incomes from the free insurance group. No different than the incomes in the free insurance group. And when I'm saying that they're not different, I'm saying that the difference is not statistically significant. Okay, so this holds for incomes. It also holds for a lot of the other demographic characteristics. And importantly, it also holds for pre-treatment. And when I'm saying treatment, remember, I'm talking about the treatment being they're treated into insurance groups. It's not some health treatment or something like that. The treatment is which plan they're assigned to. So this also holds for treatment health outcomes. And that's very important. So we have a good balance in both the general characteristics and the pre-treatment health outcomes. That means that it's likely that unobservable traits and characteristics are balanced as well. Okay, and if that's true, then we don't have selection bias. There's no selection bias. Okay, so now that we're confident, let's go ahead and write this down. Now that we're confident that the experiment is balanced, we can observe treatment outcomes. Okay, and so the way that this worked in the Rand health insurance experiment is that 3 to 5 years later, after people were randomly assigned into their groups, so 3 or 5 years post-treatment, they looked then again to answer the following questions. So first they asked, what is the elasticity of healthcare? Okay, so if healthcare is cheaper or more expensive because of the insurance that you have, how does that affect your quantity demanded, essentially? And the question 2 is, does more comprehensive and generous health insurance coverage lead to better health? Does more comprehensive and generous health insurance coverage lead to better health? Okay, and so as you can guess, these are very important questions. In the United States and other countries all around the world, there's often talk of universal health insurance, universal health care, and so if we look at these questions and see in the empirical gold standard, how does health insurance affect health? This can give us some information to help inform policy. Okay, so let's look at what the researchers found. Okay, and the kind of nice thing about randomized control trials is you don't have to do any fancy econometrics. You don't have to do any regressions or anything like that. Because it truly is random, all you have to do is examine the difference in means across the treatment and control groups, and then you check for statistical significance. Okay, and so let's go ahead and look here. This is a similar looking table 1.4 out of Mastering Metrics. This top panel here is healthcare use. And so what we're really thinking about here is that first question: how does healthcare impact how does insurance affect the demand for healthcare? Okay, and so what we can check if we want to compare, to make it easy, for our example, let's just compare those with free health insurance versus those with essentially no health insurance. These two columns here. So face-to-face visits, outpatient visits, hospital admissions, inpatient, and total expenses. So we have the means here and the standard deviations, and then we're comparing the differences between the groups. And so between each group, we're comparing those differences. So people with essentially no health insurance in the catastrophic plan versus those with free health insurance. Again, we use our standard error rule of thumb when the difference is, and so here's, for example, the difference. If that's larger than 2 times the standard error, that difference is said to be statistically significant. So 2 times the standard error here is 0.5. So 1.66 is more than 2 times the standard error. So this difference is statistically significant. That means the people who had free insurance compared to the people who had catastrophic insurance, they had more face-to-face visits to the doctor. They also had more outpatient expenses, because 169 is greater than 40, which is 2 times the standard error. They had more hospital admissions. They had more inpatient expenses, and they had more. Oh no, this one is just barely not statistically significant, because 2 times 60 is 120. So that's almost, but not quite statistically significant there at a 95% confidence level. But then we also had total more total expenses. So before we look at that bottom part, let's just answer the question about the elasticity of healthcare. So the demand for healthcare and healthcare expenses increased. And this, almost all of them were statistically significant. Statistically significant. Okay, now let's look at our second question. How does health insurance affect health? That's this bottom panel here. So again, same ones: general health index, cholesterol, systolic blood pressure, mental health. Okay, and so again, we have our averages here and standard deviations compared to those with free health insurance. So what are the differences here? Well, this difference is already less than one standard deviation, let alone 2 standard deviations. So there is no statistically significant decrease in health for those, increase or decrease in health for those who had free health insurance. There is no statistically significant effect on cholesterol, no statistically significant effect on blood pressure, and no statistically significant effect on mental health. Okay, and so what we see is, compared to those with essentially no health insurance, those with free health insurance have no better health outcomes. There's no statistically significant difference in health outcomes for those with insurance and those without insurance. And so that's a pretty huge result, actually. We see that there is no statistically significant increase in health outcomes for those with free, I'll write it all out, with free health insurance. So ultimately, we have two big results here. One, the demand for healthcare goes up. Expenses paid on healthcare go up when people get free health insurance. But their health does not. And so this type of study can really help inform the public policy debate when it comes to health insurance. What we do see in the book, it talks about another health plan, the Oregon Health Plan Lottery. That one, again, they had a balanced sample. This one happened a little bit more recently in 2008. I'm gonna leave that out of the video, but it is in the book, Mastering Metrics. Has a lot of discussion in there, and it's also table 1.6. A lot of similar results. We also saw that the demand for healthcare increased among those who had health insurance. Self-reported health increased, but that increase was not statistically significant. Self-reported health increased, but all the measured health, so physical health index, cholesterol, blood pressure, there was, again, no statistically significant increase in physical health. But self-reported health did have a statistically significant increase. And the other kind of important inclusion in the second one was that with the Oregon Health Plan Lottery, the treatment group, which is the group who received health insurance, were less likely to be financially burdened from healthcare expenses. And so that is, it did help with financial health. It did not help with physical health. So part of the reason for insurance is to help safeguard finances. And so in that sense, the insurance is playing a role in doing its part. But we do find that there's no statistically significant increase in physical health due to health insurance. Okay, that's the main result. Go check out Mastering Metrics book if you want to read the rest and see what the Oregon Health Plan Lottery had to say. But that's it. That's how you do a randomized control trial. You randomize the groups in sufficiently large enough numbers so that the law of large numbers will kick in, and each of your samples will not only be representative of the population, they'll be identical to each other, statistically significantly identical to each other in both the observable and the unobservable characteristics. And you check for balance. Balance looks good. Then you give one group or multiple groups the treatments, and you see what happens. And all you have to do is simple t-tests, comparison of means, and you're done. So in that way, it kind of sounds pretty simple, but to kind of close this chapter off and start talking about the future, and really kind of the crux, the bread and butter of econometrics, is that we can't always conduct randomized experiments. We can't always conduct randomized experiments. Why is this? So largely, there's a very large cost. It's very costly, both in time and money. In some cases, depending on what it is you're trying to study, some randomized control trials may be unethical or unlawful. Okay, and especially for social sciences, including economics, it's generally hard when you're dealing with people. So it's generally hard within the social sciences. It's a little easier in the hard sciences where you have controlled laboratories, controlled environments. You can adjust and control the different specifications and parameters to an experiment, but that's not true with people, and people behave in many unpredictable and irrational ways sometimes. And so social science is particularly hard to be running these randomized control trials, but even though we can't do these as much as we would like, with well-designed analysis and tools, we can still estimate causal effects. Okay, and that is going to lead us to our next chapter, which is regression. Okay, regression, it's kind of our go-to tool in econometrics. And so we're really going to be spending a lot of time talking about regression, different types of regression techniques, how we can design a regression well in a way that'll help us try to uncover causal effects rather than just correlations, and to try to remove that selection bias coming from unobservable characteristics. But yeah, that's where we're heading from here. Randomized controlled trials, very, very effective, very useful, the gold standard for sure, but not always easy or practical to put into place. And so moving on, hitting regression, and looking forward to sharing that with you in the next videos. Thanks.